We've got a couple of things we want to cover early, and I will take the first one. This will be my last meeting on the board. I'll be leaving the city here in about 5 weeks for, I don't know if I can say greener pastures, but a new adventure at least. And so a new chair will be appointed by the mayor's office, I imagine, before your next meeting. But Sam and Stacy might know more about that than I would. And so that was just sort of an FYI. And then we have a new board member as well. Sam, if you want to introduce him, and then.
Yeah, I'd like to introduce James Huang. He's our new board member. He's also from Standard Insurance. We had spent quite a bit of time looking for some new candidates to be on the board. Elizabeth, our past board member, nominated James. So we talked with him, and Commissioner Hardesty talked with him and had nominated him, and he was approved by City Council. And I thought I'd let James, he does a great job of introducing himself. So I'll let him introduce himself here. Go for it.
You're too kind. Well, thank you so much. It's really nice meeting everyone virtually. I hope to meet you guys soon in person. It really is a privilege to be a member of this board. And just a little bit about myself. I moved to Portland from New York City about 3 years ago to join the Standard Insurance Department's, insurance company's law department. And I'm currently a second vice president and associate counsel in the law department. My background is really securities law and regulations and how they apply to the retirement industry. So I'm really looking forward to learning, more about FPDR and really working with everyone to further the interests of the fund while really protecting the interests of the citizens of Portland. So I look forward to, again, working with you guys and learning, as much as I can to support the endeavors of this fund. So thanks.
Great, welcome, James. I'm sorry we're not going to get to work together for very long here, but anyway, so we've got a light agenda today. We should go hopefully relatively quickly. First, anybody have any problems with the minutes that you see there? If not, I will entertain a motion.
I'll make a motion. We approve the minutes as presented and written.
Thank you.
Second.
Are there any objections? Seeing none, the minutes are approved from our May meeting. Are there any introduction of visitors that we need to do?
I don't think so. And there is one attendee. Mr. Nelson Hall is here. I didn't see him registered though, but that was like half an hour ago, so he may have since.
Okay. Then we will move on and to our main agenda item here, which is, or I guess I should say, is there any public comment then? Kathy, do you have anything?
No, but there is one person, Attorney Nelson Hall is here as an attendee, but I'm not sure if what item he's registered for, because there was no one registered when I had checked the registration about half an hour, 45 minutes ago. And it may be for the rules, Sam?
Oh, Sam, you're on mute.
Sam, you're on mute.
Okay. Yeah, no, I haven't seen anything, heard anything from Nelson. I imagine it would be for the roots, but I'm not seeing him on our list or on the screen here.
He's an attendee, not a panelist right now.
Okay, so I may just have the panelist view. Okay. So I think, it's because what probably jump ahead on you, Josh, is that we're going to talk over the administrative rules and a new administrative rule. Let's see if I can get my notes. Am I jumping too far ahead up for you there, Josh?
I'm jumping ahead, Sam. If anybody has any objections, speak now or forever hold your peace.
Okay. So we're going to talk over Resolution 536, which is the application of the workers' compensation heart-lung presumption to the FPDR plan. There's a couple of things I wanted to do before we actually hit the resolution itself. First one is I just wanted to do a brief overview of administrative rules. That was for James and unfortunately for Christopher, and I'm not showing his here, but I can go over this with him later. I think some of the people have been around a long time, especially in the city, take rules for granted, but I just thought I'd go over some basics. So the state of Oregon has sort of a large wordy definition of an administrative rule, so I'll read it to you. An administrative rule is any agency directive, standard, regulation, or statement of general applicability that implements or interprets or prescribes law or policy or describes a procedure or practice requirements of an agency. So that's the formal definition of it. How it applies to FPDR, more a human. So what we do for how we use rules at FPDR is we use them to implement and interpret Charter Chapter 5, the FPDR plan. We use it to prescribe some policy for the FPDR Bureau or how FPDR approaches its work. We use it to describe some procedures or practices for the administration of those benefits that are defined in the charter, procedures and practices that our members have to follow if they want certain benefits. And then also we use the rules to correct prior rules that were either ambiguous or inconsistent or failed to meet the standards of the expectation or delivery of the plan. In this particular rule that we're applying is that you'll see that for this, well, I'll deal with that later, but that's in general what we use rules for here in FPDR. We have the large book here of FPDR administrative rules. And I believe you all have links to it. If not, I can send them to you, or if you want a hard copy, let me know and we'll get you a hard copy. And then, so even more specifically to FPDR, section 5202A of the city charter says the FPDR board shall have the power to prescribe rules and regulations for the administration of this chapter and to provide for the enforcement of the same. In other words, they have the authority to approve these rules here, tell us how to run the plan. And believe it or not, even the administrative rules have rules about administrative rules. So under our administrative rule book, chapter 5.1, how it says that all proposed or changes to administrative rules must be referred to the Board of Trustees, you all, and then you will consider those proposed changes in additions and either approve them or reject them. I have some responsibility is I'll provide you all with the technical expertise and resources necessary to understand and review any rules that are presented to you. I, as a director, also will develop the administrative rules and amendments for review by the board. In other words, basically any rules that come to you for consideration must come through me or the FPDR Bureau then to go to you. So they can't be proposed by anybody. They just, so they have a process, they have to come through the Bureau or through the director. And then I have the responsibility of posting any proposed rules or changes at least 30 days prior to the board session where you're going to consider that rule. And also we will post those on the FPDR website. And then also many times if the rules are complex or have some significant changes, I'll hold a public question and answer session where we'll, after some time between the 30 days where they're published and they come to you, we'll talk with the public. They can go over and say what they like or don't like or bring up their concerns with the rules. We have taken feedback from those Q&A sessions to revise or tweak the rules that we're presenting to you. And in one case, we actually pulled the rule completely and did not present it to you. And then when you accept the rules, I am responsible for publishing and distributing those rules. Now, I did make one comment that wasn't quite right. When rules are presented to you, you can approve the rules. You can approve the rules in part and reject part, or we can do a little bit of minor wording changes while you're considering it, and then you can pass it. If you want to make significant changes, usually what we do is we'll pull the rules and resubmit them at another board meeting where we can go through that. So are there any questions or comments on what admin rules are? Okay, so I just wanted to give everybody a background for that. And let's see, let me get my other notes here. So actually I want to start walking through you the actual the law, because what we said, why we're here for this, a lot of feedback from somebody. Everybody on mute, okay. There we go. So what we're doing today under this resolution is going to introduce the heart-lung presumption and have it captured in the rules. Actually, the first thing that has to happen is the city council, because this is a charter change, they have the authority under 5403A to make that change to the charter. It's actually not to the charter, but it's to the, it is the equivalent of charter language to that. So they've already approved it. So under the charter, we have accepted the heart-lung presumption and will pay benefits accordingly. And then what we do is need to capture that in the rules. So it states it in the rules. Pretty straightforward of what we're trying to do. But what I wanted to do today is just explain what the presumption is and what it's about here. So I've got some notes off the side. That's why I'm looking over here. So the heart-lung presumption itself in the Oregon Workers' Compensation has existed for 30 or 40 years with that. It's just that they decided they now wanted that to apply to FPDR, because FPDR members are not subject to Oregon Workers' Compensation laws. They're not considered a covered employee under that law. So this sort of says, okay, FPDR, you're now going to give Portland firefighters this FPDR presumption. And let's see if I sent you, I believe I sent you a document, if I can now find where I've got it, and I'll share it with you because I want to walk you through the document so you better understand what this does, and it'll help you compare to what we are doing in our thing. I'm going to share a screen here with you. Okay, you should see a document here that has at the top comparison of ORS 6568024A, which is the heart-lung presumption in the Oregon Workers' Compensation Statute. And we're comparing it to Charter Section 5306D, which is our occupational disability benefit. And the reason why I did it because they're very similar, and you'll see as we walk through this. The heart-lung presumption was added to the Workers' Compensation Law in 1990, as I said before. The 5306D was added to our charter in 1989, just 1 year prior. The state statute here is broken into 4 sentences, pretty straightforward. So I put each sentence in its own box here, and I'd like to just point out the important parts of the heart-lung presumption, and then compare and contrast it to our occupational disability side. So basically what it says death and disability or impairment of health of firefighters, that's keyword there, of any political division who have completed 5 or more years of employment as a firefighter caused by any disease of the lungs, respiratory tract, hypertension, cardiovascular, renal disease, and resulting from their employment as a firefighter is an occupational disease. That's just telling you what conditions are covered under this presumption. Key here is it covers only firefighters, where we have our occupational disability benefit here. It covers firefighters and police officers. And it applies the presumption, the state presumption applies to these 3 sets of conditions. First is the heart and lung, the disease of the heart and lung respiratory tract. So this is a very broad definition of inclusion of a lot of different respiratory diseases. Compare it over to ours, it's only pneumonia and tuberculosis. So this can cover an awful lot. Respiratory tract starts with the nose and mouth, goes through the throat, trachea down to the bronchi and into the lungs. So it's that extensive. It covers hypertension, which is not in our list. And it covers cardiovascular and renal disease. We just cover heart disease. So this covers, again, it's a broader classification of cardiovascular diseases that we have. So this is one of the draws to this, is it's a broad, this presumption covers a lot more conditions than what ours does. Interestingly, ours covers hernia, AIDS, and hepatitis B. With that, the occupational disability, or the presumption, also requires 5 or more years of employment for all these conditions. And that employment can be, let's say somebody worked at Corvallis Fire for 2 years and then came up to Portland. Those 2 years are credited toward those 5 years of that. We only require 5 or more years of employment for heart disease for these conditions. Now, the next paragraph is what makes this a presumption, because it says it's a presumption. It says any condition or impairment of health arising under this subsection shall be presumed to result from firefighters' employment. In most workers' compensation claims and FPDR disability claims, it's the members of the disabled employee's responsibility to prove or show that the disabling condition is a result of their employment. So it's up to the member or the injured person to show that it is a covered disability. Presumption flips that and now says that they're going to assume that it is a work-related disability, and the workers' compensation administrator, in our case, FPDR, will have to show that it is not work-related. So it switches the burden from the member to show that it is work-related to the administrative, to the claim administrator to show that it is not work-related. So that's why the presumption is. So you start out in the firefighters, in this case, the firefighters' favor that this is a work-related condition. We just have to show, if there's indication that it's not, we'd have to show that. Excuse me. Interestingly, under the 5306D section, our occupational disability, it does not say in the charter that these are presumptions, or it is a presumption. It does imply it on how it's written. So it is clarified in the FPDR administrative rules. Again, one of the reasons why we write rules is to clarify the charter. It's clarified in the charter in in the rules, two different places, that people with these conditions, it is rebuttably presumed that the conditions arise out of in the course of an employment. So again, we do it through rules. As both of these just say, hey, look, these list of conditions are presumed to be disabling. Let's come to the third sentence. This one, it's key because this has some different wording that you can see. It's not over here under the FPDR plan, is that a firefighter must have taken a physical examination on becoming a firefighter or subsequently thereto. It means basically you've had to have a physical prior to submitting a claim, either at employment or prior, prior to submitting a claim that revealed that you did not have these conditions to begin with. This is a way of saying that you don't want to get, you've got really bad hypertension. I'm going to become a firefighter. And so on day one, I'm going to have a firefighter, or not a firefighter, but a hypertension claim. No, this says, first of all, you have to have 5 years of employment, and you have to show that you didn't have hypertension when you were employed or at any time before you filed the claim. The interesting thing is physical examination is not defined completely what it is. I think there's interpretation that's usually a physical, not just simply because you go in with a stub toe and they listen to your heart and your lungs with the stethoscope. That wouldn't be really considered a physical examination. However, should this one particular sentence become decisive in approving the presumption or not, we will look through workers' compensation claim history and claim decision history to see how they have defined physical examination and how they've treated the situation. Like I say, they have 30 years of history with this particular provision. So we're not going to be breaking any new ground. We're just going to have to interpret what ground has already been covered. So now this is another important paragraph. So a denial of any claim or condition or impairment of health arising under the subsection, so any of those conditions that were mentioned above, must be on the basis of clear and convincing medical evidence. Basically, remember when we said it was a presumption, it becomes the workers' comp administrator to, it is responsibility to say it is not work-related. And they have to do this one at a level of clear and convincing medical evidence. Just as a contrast, similar wording was in the FPDR plan. It's called preponderance of evidence. Oftentimes you'll hear a concept of percentages. They really don't make a whole lot of sense, but I think in relativity, it helps out. Preponderance of evidence, and I think some of you remember we had the same discussion when we did the PTSD presumption, because they use the exact same wording. Preponderance of evidence means you only have to have proved 51%. So you have to be more likely than not to have not been caused by work. So it's a low standard, about 51%. Clear and convincing, there isn't any true percent, but if you're using percents, it's 75 or 80%. It's a pretty high bar to overcome. With that, you really have to have clear and convincing evidence of that. So again, that's another. So the two things that this presumption has, that's the state presumption has that we don't have. It has a much larger list of diseases that it covers and conditions. and it has a clear and convincing medical evidence standard for presumption, for rebutting the presumption. So that's comparing and contrasting what we have in our present, what we have in the FPDR plan. Now, what this presumption here, or the Oregon statute 6568024A, does not replace for 5306D. It supersedes it. The difference is if somebody files a claim that they're claiming for this condition and they meet all this stuff, we will follow all the requirements that are set under the state statute. If for some reason their conditions don't meet this or don't meet this requirements, we then will go back in and look at 5306 in its entirety and see, do they have an occupational disability benefit? If they don't have an occupational disability benefit, we go to 5306B, which is our general service-connected disability plan. It's a lower criteria. It has no presumption on it. So again, it's key that this is just supersedes, it does not replace. So we still will use this, especially for police officers or people that have these conditions that aren't covered over there. And we'll use this if they fail to comply or meet all the requirements under this presumption. So any questions on that? Put a lot of information out there real quick for you. Okay, let me go through that one more quick thing here. I wanted to make sure I covered all the points. So the effective date of this presumption, as far as FPDR is concerned, was for claims made on or after June 1 of 2021. With that, so there's just any claims that have been made recently in the past 2 months would qualify for this. Exit claims that already been filed before this will not be covered under this presumption, will be handled under 5306D or B. Okay. Do one real quick thing here. Sorry, I'm having trouble. Trying to stop sharing my screen and it's not. I'm not. Kathy, I don't know if you can kick me. I'm not. I've lost those. I lost the button here. It says I can quit sharing my screen. So I don't know if you can take that from me or not.
Okay.
Good. Okay, there we go.
Okay.
So it looks like they got done. Thank you.
Mm-hmm.
With that. So we'll go back here and so we have. So the resolution, which I'm not going to share with you, basically says that we are now required due to state statute to apply to administer, and now the city charter, to administer our claims under this presumption when they apply. We have Exhibit A of the presumption, or not have the ordinance, list the exact wording of the rules that we're going to change here. So what we've done under disability claim, I'm going to try sharing the screen again here, see if I can. Okay, so here we have Exhibit A. Just wanted to show you what the rules would look like. What we've done is a couple things is to clarify these different categories of disability claims. So service-connected disability claims is the basic claim. It falls under section 5306B and C of the charter. We decided to put that in here just to make it clear as to what we're referring to. Then came down here to occupational disability benefit, which is the other one at 5306D, which is the one I just compared everything with, or the statute with. And then what we did is we restructured how we're showing these various presumptions. Instead of adding everything with a new number, we classified them all as Oregon statutory presumption claims, and then got specific on the 3 kinds that we now have. We added firefighter heart-lung presumption. So this is the only substantive new thing that are in the administrative rules. PTSD was passed a couple of years ago. Firefighter cancer, about 10 or more years ago, that was added to the plan. So this is what you're voting on today, is the these changes to the FPDR rules, which is a little clarification, a little structure change, and then adding 3A, which is the heart-lung presumption. Does anybody have any questions on anything I've gone over? Thrown a lot at you here. Just any questions on it?
I have one simple question. I think you mentioned that those falling under new paragraph 3, the Oregon statutory presumptive claims, are effective for claims on or after June 1st, 2021. Is that?
Yes, the firefighter heart-lung is on claims filed on or after June 1.
Okay, and so my only question is, does it make sense to reference that date in here at all?
That date is referenced in the city council ordinance, which actually has the, if you notice here, we don't have the wording of that. That was in the city council ordinance, and that has that in it there.
Okay. Okay. That was my only question.
Okay.
Other than I don't know how the heck you administer that, other than just automatically presuming that if someone raises a claim in this area, that they are undoubtedly covered.
Well, that's one thing I didn't bring up. A presumption is not a guarantee of claim payment. That is something that we run into, unfortunately, a lot with members. A presumption means it's a higher level of rebuttal. If there's indication or evidence showing that it is not work-related, it meets the standard, in this case of clear and convincing, then it is our responsibility, and actually the charter says it's my responsibility and requirement to deny the claim with that. So a presumption is not a guarantee. We run into that a lot as a misunderstanding. Presumption just raises the level of information and proof that we need to deny a claim if that's the appropriate decision to make.
And Sam, I'm assuming that you also make sure that, or the claim administrator also will have to make sure that the firefighter, will have taken the physical examinations, upon becoming a firefighter as a condition precedent to administering the claim, right?
Yes, that will be always one of the tests we go through. Some of the firefighters may have been hired before their regular physicals, so we have to follow up and see, did they have some subsequent level of a physical exam?
Yep. Thank you.
I just have one quick question too. You may have said it, and I apologize if I missed it or if it's in the documents, but do we have any sense of the financial implications of this at all? I mean, my sense is that it's not enormous or anything, but I'm just sort of curious.
I asked him to look into that, and really we can't predict how many are going to be here, because there are going to be people filing claims that they have not filed before, because they now think it's covered under the presumption, and probably rightfully so. Many of these claims can resolve fairly quickly. Most respiratory things resolve quickly, and surprisingly, a lot of the cardiac claims resolve fairly quickly. Where you run into your higher end claims is that they have a catastrophic cardiac incident or catastrophic respiratory incident. They can be off for a while, or wildly out of control blood pressure or hypertension. We also have where one of the things that can increase the cost, or if somebody is on medication, let's say they're 40 years old and they take it, but they're going to be taking lifetime cardiac or hypertensive medication, and we approve the claim, we will pay those medication costs all the way, even after they're retired, and until, as long as that the need for that medication is tied back to the original claim. So you can be looking at decades of payment of certain medical bills for some of these. That's where you can end up on some of it. But again, in short, we really don't know. We don't know we reach out and talk with some of the other workers' compensation administrators that have done these claims for decades, and they weren't able to give us really any viable information on this.
Okay, thanks.
I'll just step in on this. In my work, we've been asked this question over the last 10 years from other states and agencies that have had this kind of statute in effect before. State of Nevada is a good example. Something like this in place since 2008 or 2009, I believe. And it's very difficult to do actuarial projections of it, because when you look at it just from a pure, projected claims point of view, we could see claims, increasing tenfold from some of these things potentially. But then we monitored some of the situations, every 3 or 4 years following, what you would expect would have been a huge emergence of new claims coming through, and they just weren't being seen. And it just wasn't clear whether the rank and file were just not fully aware of the potential for this, or whether or not things resolved more quickly, as Sam was alluding to, and didn't end up being really long-term things. But even a decade later, we still get questions periodically from those agencies that are concerned about the exposure there. And I agree, I think it's very real, but being able to put your finger on it and really project it is a really challenging thing.
And that's one thing you find when you talk with SAFE and some of the other workers' compensation carriers. They don't see a huge volume of heart-lung claims out there. So yes, they're there, but they're not a huge volume, and they're not a huge part of their costs. And so we're going to make the same assumption that's going to be true for us. And it may be slow for those claims to come in, or it could be a big wave of claims coming in and then settling down after a little while. We don't know, and we're just gonna have to wait and see, but we just don't think it's gonna be a big financial hit given the whole volume of claim payments we make.
Yeah. One other thing that I wanted to mention about this is that in what we've been able to observe, that apparently a lot of the general health claims for this kind of thing seem to be going through the normal medical plan, as opposed to workers' comp. So in some instances, things that seem like they would fit under here, the employee is just going to their normal medical provider and getting claims paid that way. And so it's not actually flowing through to the workers' comp plan.
I will tell you, the medical providers, if they get an inkling that they think it's work-related, they'll bounce the people back to us, or they'll reach out to us. So they don't look up, they always look for an opportunity, because we'll pay 100% of the cost for medical doesn't. So if they find out or think it is, they approach us and ask us about it. Okay. Everything I have.
Else, Sam?
Nope, that's all I have on this.
Okay, any other questions or discussion? All right, it looks like we need a motion.
I can make a motion to approve resolution number 536 as written.
I second that motion.
All right, motion's been properly made and seconded. Are there any are there any notes? Great, motion passes, and we will move on to the final agenda item, which I assume is going to Stacy for the summary of expenditures.
Yep. Hello, everyone. For the benefit of Trustee Wong, I'm Stacy Jones. I'm the FPDR Deputy Director, but I'm also the Pension and Finance Manager. And we give the board at every meeting an expenditure report and a revenue report, so you can see where we are with expenses and revenues thus far in the fiscal year. So when we sent this to you a couple weeks ago, we had not yet closed June, and thus the fiscal year. Our fiscal year runs July 1 through June 30. So what you're looking at is just through May. But so in particular, this report doesn't give you the full picture of our PERS contribution expenses, which is the second line under internal materials and services, if you happen to have that expenditure report in front of you. And that's just because both police and fire got pretty behind in their billings this year. So those don't reflect even the Q3 billings, let alone the Q4 billings, both of which wound up being billed in June. So you'll get a full report on how expenses and revenues looked for the whole fiscal year at the September board meeting. But just to give you a little preview, We did finish the year within budget in all categories, which is a good thing because it's against, Oregon statutes not to do that. We were right to increase the pension budget and the disability budget in the spring budget adjustment, and we increased both of those budgets by $1 million. And if we hadn't done that, we would have overspent both budgets slightly. So I'm glad we did that. The other kind of notable thing is that we got a really nice June tax turnover. And so we wound up with about $168 million in property tax revenue, which is about $2 million more than we budgeted. So that shows that compression and delinquency losses, were maybe not quite as bad as we feared they might be this year. Then again, that 2 million is only a 1% over collection. So we weren't too far. We weren't too far off. Those are, really the only things I would point out about the expenditure report is that it's just through May, doesn't give you the full picture for PERS contribution expenses at that point because of billing timing issues with police and fire. And that you'll see the full year report in September, and that everything looks good, and that glad we adjusted that budget a bit in the spring budget adjustment. Any questions?
Questions for Stacy? All right, thank you, Stacy. Anything else you want to cover, Sam, while you have us here? You're muted, Sam.
Glad you didn't hear me swear. Let's see what we've got here. So Christopher and Jason, your terms as trustees in this year, December 31, 2021. That's your end of your 3-year phase. So you will go through an election process as we do every 3 years, and that will begin in October. And Kathy Kakasako here, she will coordinate the election, and then the auditor's office validates any final results if we need to go through a full process of doing of vote counting. So we'll just keep you appraised of when that whole work starts. With that, let's see what we have here. Just a couple, one more heads up for you is that if you go back through and look at the resolution you just passed, it has Exhibit A, and at the very bottom it says COVID rules. If you look at the very end of those COVID rules expire 180 days after the end of the mayor's declaration of emergency. He has continued to renew that emergency. I think it goes now through mid-August, just to keep you on your toes, because I think at some time I would expect in the next few months for him to stop renewing that emergency. And when he does, that 180-day clock will tick. We're getting very, very few claims. I think we've had one claim in the past 60 days. And so we'll keep our fingers crossed here that this Delta variant and Lambda variants that are floating out there don't explode and really cause a lot of problems for people that have been vaccinated, or even for some of the members that have not been vaccinated. So it's still in effect here, but I just want to keep you appraised of that. At some point, I expect that 180-day clock to start ticking, and that should be in the next couple months, unless again it explodes and there's good reason to continue the state of emergency. And then for
Sam,
next month, yes.
Sam, can I ask about this? Just because there's more news about reintroduction of mask mandates and/or some, federal and municipalities doing vaccine mandates for employees. Is there anything of concern? It sounds like the level of COVID claims is low, has been low enough that it's not a concern, but I'm just wondering if the city of Portland has, made any noises about requiring either mask mandates or vaccine mandates.
City of Portland will not have a vaccine mandate. They've made that decision that they're not going to do that, and I don't anticipate a change to that. Right now, what they're doing is following Oregon OSHA's mask guidelines, which is people who are vaccinated don't wear a mask. Other people, non-vaccinated people should be wearing masks. It's on the state OSHA website. I know Multnomah County is now requiring, or not requiring because they can't, but it's strongly urging that people, even vaccinated people, wear masks on the indoors. I don't know if the city of Portland is going to mirror that, or if they're going to stay matching the state. So you might see a change in the city's mask mandate, which right now is very lax, matching the states. But I know they will not go out and do a vaccine requirement.
Okay, thanks for that update.
Okay, and then the last thing is we have the September board meeting. We have the state of FPDR. We may have one or two contract approvals for our technical contracts that are expiring toward the end of this year, and we're getting working with procurement to extend those contracts. So we'll bring those to you. They're the ones that keep our database and some of our other systems operational in the Bureau. And you may have in September, I doubt in September, but November, you'll probably be getting our MCO contracts will be coming up because those expire January or December 31 of this year, or in December. I think they're different dates, but in December. So you'll be reviewing different contracts between now and the end of the year.
All right.
That's all I have.
All right, great. Anything else for Sam or anybody else? Thank you, everybody. It's been my pleasure to serve on the board. I'm sure I leave you in more than capable hands. And with that, I suppose we are adjourned. Thank you, everybody.
Thank you very much. Miss you, Josh.
Yep. Bye, bye, Josh.
Hi, everybody.
Best of luck.
Best of
Thank
luck
you.
to Josh.
Nice meeting you virtually. Bye.
Nice to meet you, James.
Thank you for everything, Josh.
Everyone.